Gonzaga actually started its graduate nursing program in 1978, as I understand it, and it began as a distance education program mostly intended to serve nurses who lived in very rural areas and were not able to leave their home communities to attend an on-campus program. And then the program expanded. We offered a RN to BSN program, or another option was an RN to MSN. And that program was actually targeted nurses who had a diploma in nursing or an associate degree in nursing, and to allow them to come back to school and either earn a Bachelor of Science in Nursing degree or a master's degree. And so we had both of those, have had both of those programs in existence for many years. And then in 2005, we began to look at our undergraduate nursing program. At that time, we admitted students to Gonzaga, and they took their prerequisites and their university core courses here on campus, and then had the option to either attend the consortium program with Washington State University's College of Nursing, or they could transfer to Seattle University. But about that time, about 2005, we realized that we just were not able to get the number of students into the consortium program that we had hoped, and began to look at actually teaching the last 2 years here on campus. So we made that decision to actually start our own BSN program, and so we have been doing that now since 2006. Well, we are beginning our DNP program as a postmaster's in nursing program. So it's really targeted to nurses who already are certified as primarily family nurse practitioners or psychiatric mental health nurse practitioners, or also nurses who are in management administrative roles. The benefits to the students, I think, in attending our program are that it is fully online. There are 2 immersion experiences where students will be required to come on campus. Otherwise, it is fully online. The courses will be offered in 16-week formats, so they'll run the entire semester. We have very experienced faculty who all of them who are nurse practitioners continue to practice in their nurse practitioner roles. So I think what the students, in their interactions with faculty, they will be getting very real world, instruction from people who are immersed in day-to-day problems and challenges in our profession. And I think our faculty are make every effort to be very accessible to students. They're online every day with students in Blackboard discussions. So I think there are many benefits to participating in our program. We actually are planning 2 required immersion experiences for the DNP students. The first one will take place within the first month of the program, and students will be expected to come to campus probably for a 2 to 3 day experience, and we do not have that totally planned out as yet. But the idea would be for them to meet faculty who are teaching in the DNP program, learn about their research interests and scholarly interests. We will also begin to talk to them at that point in time about their scholarly project and begin to work with them on formulating their ideas for their scholarly project. They will have an opportunity to tour campus, to really learn about Gonzaga and the mission of Gonzaga. And mostly, just really form a community with the other students who are participating in the DNP program, because we know that becomes very important, particularly for distant students who aren't seeing each other every day, but that experience of community is no less important for them. Then so there'll be a lot of work that weekend, getting them focused on their scholarly project, how to begin to do a literature review, just sort of laying out for them what that means. And we have a whole host of things to cover that weekend with them related to IRB applications and just preparation to be able to get started on their scholarly project, how to set up their practicum experiences. Then in the second immersion, the focus will be for the students to come to campus and actually present their proposal and to defend their proposal to the faculty. Because before they can actually go out and implement their project or their change project, they really need to have faculty approval to be able to do that. So, and the project really focuses on something that the student has experienced as an issue in practice, whether it's in their leadership practice or their clinical practice, that they would like to change or improve. So they're really asked to address the day-to-day issues that impact nursing practice and to try to make a change or to improve that situation. I think the philosophy behind our curriculum has really been, honestly, to think about how to prepare nurses at the DNP level to really go out into, their practice arena and make a difference, to be able to be change agents, to be, and to base their practice on the best evidence that's out there. And certainly our program has been built very intentionally upon Jesuit values, and throughout the courses that we've been developing, we have utilized and relied on Jesuit pedagogy, which really has us look at who the student is and what is the context of their experience coming into the program. What are the experiences and knowledge base that the student brings with them into the program? So certainly we try to build on that, and then through the courses, the students are building on that knowledge base that they have, learning more about Jesuit values and, what is it that, how does that infuse our program? How are those values infused into our program? What does that mean for a student who graduates from a Jesuit university? So I think our students are steeped in Jesuit traditions and Jesuit values and philosophy, and really, I think, will leave our program with wonderful skills and tools to really make a difference wherever they practice, whether it's as a nurse practitioner or a nurse administrator or nurse leader. I think we have a fairly diverse faculty. We have one of our nurse practitioner faculty currently is involved in it's actually a Center of Excellence grant at the VA hospital in Boise, and they're looking at how do we bring medical residents, psychology residents, pharmacy residents, and nurse practitioner students together and really build a team that learns together and can practice together with a much better understanding about interprofessional collaboration. And what she's finding is that a huge piece of that and being able to collaborate well as a team is the whole notion of trust and whether we trust each other. So she's very involved in looking at that whole experience. She has also, the same faculty member has done research in the area of understanding, well, I think it's sort of breaking down some of the myths around obesity, because we often think that individuals who are overweight and obese have no desire to exercise or make healthy life choices. And what she has found is that that's absolutely not true, that many of them have, many individuals who are overweight either already do exercise on a regular basis or have a great desire to do so. And so she's really debunked some of the myths, I think, around individuals who are really struggling to lose weight and make healthy life choices. We have, I'm trying to think of our faculty now. One of them has done a fair amount of research on men and depression and is very interested in that topic. One of our other faculty has, her research interest is around transcultural nursing, and she's done work with the Native American, some of the Native American tribes, and looking at the problem of diabetes. Another faculty member is very involved right now in health policy, in the health policy arena, and she actually will be on a leave of absence next year back in Washington, D.C., working with the Center to Champion Nursing in America. So she's very involved in, what does it take to change health policy in a positive way that enhances our healthcare delivery system. My own research has been primarily in the area of authentic nurse leadership and how do we develop authentic nurse leaders. Another one of our faculty who will be teaching in the DNP program is very interested in the area of elderly and nutrition, and how do we promote best practice in caring for our older Americans. So that just gives you a flavor of some of the research in which our faculty are currently engaged and the interests that they have. The minimum number of credits that a student must complete is 30, and if the student takes 6 credits a semester, which is a typical, would be a typical full-time load for a graduate student, the student could complete the program in 5 semesters. And we will be, our program is a 12-month program, so we'll offer courses fall, spring, and summer. What that would mean, though, is the student has to come into the program with a pretty keen idea of what they want to have as the focus of their scholarly project, so that there's no delay in really gearing up to be able to implement that project. Now, a student would not have to complete the program in 5 semesters. There are options for students to go part-time, but if a student wanted to complete 6 credits a semester and they were able to really move along in completing their scholarly project, they could complete it in 5 semesters. Part-time status would be a student who's taking 1 course or 3 credits. And if a student wanted to take a semester off, that's perfectly fine. The only stipulation is that students in our graduate programs must complete the program within 5 years. If they go beyond that, then there needs to be an appeal to the dean to be able to graduate if they've extended beyond that 5-year deadline. What I know in terms of our graduate students is that they are primarily taking out loans to finance their graduate education. Some of them are able to find scholarships. For example, if their states offer graduate scholarships for graduate students for students to pursue graduate education. Or sometimes students find scholarships through professional nursing organizations. But I think primarily students will finance this through student loans. Most of our online classes are designed in 4 modules. So each module has a particular focus, and within each module there are readings that the students need to complete. Often we engage them in checking out a number of related websites that offer information that would be helpful on that topic. We also have Blackboard discussions where the faculty and all the students engage in online conversation and dialogue about that particular focus area. And then there may be assignments that are associated with each module. But typically, online learning it's asynchronous, so that the students can actually go online whenever it's most appropriate or convenient for them around their work schedule or their other family obligations. But it's very intense, and the courses move along, and there are deadlines. It's not like a correspondence course, or it's not a self-paced course. Students really do have to engage with other students and keep up with the requirements in the course. I think a couple of things that we know help a student to be successful are, has the student really investigated the program? Do they really understand the requirements? For example, the requirements to come on campus twice during the program. Do they understand that a major requirement to complete the DNP is the completion of a scholarly change project? And the student also needs to complete a minimum of 350 practicum hours. And since this is a postmaster's program, those practicum hours are not focused on clinical care of patients. It's really focused on engaging the student in whatever clinic setting or organization they want to affiliate with in order to complete their project. So I think really understanding that a student has the support at home and the financial resources to be able to complete the program, so there aren't any bumps in that respect along the way. Now, life happens. Students sometimes have to have surgery or become pregnant and have babies, or there may be deaths in a family. Those things happen, and we understand that, and we work with students around those kinds of challenges. But I think it's important to really talk with the student and make sure that they understand what the requirements are, that there's a lot of scholarly work on the student's part that must be completed, that takes time and real diligence and a desire on the student's part to really produce a project that is excellent and that contributes to our profession in some way. I think the other thing is that the student really needs to have the commitment to do the work that's required, and that they understand that this is doctoral level work. So we don't throw those kinds of assignments together at the last minute. It takes planning and foresight and hard work and a lot of literature review, a lot of study. So the student really has to have support at home to be able to find the time or have the time to make that sort of commitment. One of the things I forgot to mention previously is that I think another thing that the student really has to have a fairly good idea about is the project that they want to complete, because all their practicum is driven by that, by understanding what it is they want to study in terms of their scholarly project. Their practicum also revolves around that. So for example, if I'm a nurse practitioner and I want to look at a different way of managing diabetic patients, or engaging patients in managing their diabetes, that would be a better way to say that. And I want to conduct my project around some innovative strategies that I want to utilize to try to gain greater compliance from patients. They have to understand what that project will entail. Is there a clinic site close to their home community where they could engage in that sort of work? So everything really revolves around the idea that they come with that they want to pursue in terms of that project. So then their practicum hours would include things like setting up that project at a particular clinic or organization, their literature review to prepare them to be able to engage in whatever that change is that they want to implement. It includes hours working with their preceptor around that project, preparing their application for the IRB so that we get approval, that they get approval to be able to conduct that work. So the practicum, I said it had to be a minimum of 350 hours because we know that students in their master's program complete about 500 to 600 hours of practicum. And in order to be, to graduate with a Doctor of Nursing Practice, students have to complete 1,000 hours of practicum when we look at their master's work and their doctoral work combined. So the practicum hours really depend on the number of practicum hours the student completed in their master's level coursework. So if a student completed 500 hours in their master's program, they have to complete an additional 500 in our DNP program. If they completed 360 in their master's program, they have over 600 they have to complete. So it's really driven by being able to validate what the student did in their master's program. Well, actually, the first group of students that we admit will come in as a cohort. And it would be ideal if those students progress through the program as a cohort, but that's not essential. As we roll out all of the courses for the DNP program, if a student needs to drop back to 3 credits or needs to take a semester off, then they just pick up with the next group of students that enroll. So while we think there are advantages to them in moving through as a cohort because they've built a bond and a community with that group of students, it's not essential because they'll continue to form close relationships with whatever group of students they travel along this journey with. Our courses are not self-paced in the sense that students start them and finish them on their own timeline. There are deadlines in each course, and students need to meet those deadlines and complete the requirements according to those deadlines. So it's not self-paced in that sense. But having said that, our faculty totally understand that our DNP students, just like our master's level students, are mostly working professionals. So if something comes up at work that students need an extension on an assignment or need to have some other arrangements made, our faculty are used to doing that and working with students within reasonable parameters. Students will be assigned to a faculty advisor, and actually we're thinking that their faculty advisor will primarily be the person who is advising them on their scholarly project, because that will be the faculty member with whom they work the most closely throughout their DNP program. Well, I think like anything in life, we get out of something what we put into it. So I think in order to complete this program with a real sense of accomplishment, I think it will require students to be diligent and to be scholars in the sense that they are wanting to develop a project or to complete a project that really is based in current evidence, that they're bringing the best evidence from the literature and from experience to bear on their project, that they're diligent and hard workers and really want this to be something that enhances their current practice. I would think that's why they're coming back to get a DNP, because our healthcare environment, healthcare system has become so complex that it calls each of us to constantly be learning and studying and growing in order to give our patients and our staff the best evidence that's out there in the literature. So I think to be successful, they really need to have that commitment to actually engage in really scholarly work. Actually, with the first group of students that we admit, we will be rolling out those courses, a couple of courses each semester. So I think for the first group, they will basically be taking those courses in sequence. But once we have all the courses rolled out, with the exception of the first semester, the courses can be taken in different sequence, so it's not anything they have to do in lockstep. Gonzaga's nursing programs, our BSN and our master's degree programs, are accredited by CCNE, which is the Commission on Collegiate Nursing Education. And we intend to seek accreditation for the DNP program. We have to have operated the program for at least 1 year before we can seek accreditation, but we have already talked about planning to have that visit from CCNE in the fall of 2014 would be our goal. Well, faculty, when we're teaching online classes, faculty are online basically every day. So I think in that sense, they are accessible. And we each usually put like a discussion forum in our online classes that says, I have a question. And so if they're course questions, we usually try to answer those there, because then the answers are available to every student in the course. If they tend to be more personal questions, then faculty respond to many emails every day, or we're happy to schedule phone appointments with students so that we're not playing phone tag, but we're actually able to focus on that student during that time. So I think we make every effort to get back to students within about 24 to 48 hours if they have questions. It is important to know that all of the faculty teach across all of our programs. So they may also be teaching an on-ground class in our undergraduate program. So faculty are not just at their computers all day, and I think sometimes that's hard for our distance students to appreciate because they're not here on campus.